Hi, everybody. My name is Connor Lynch with Westwood Media Center. We are proud to be partnering with the Council on Aging to provide virtual programming through our cable channels and online to keep seniors engaged throughout the coronavirus pandemic. We can be found on Comcast channels 8 and 12, Verizon channels 32 and 42, as well as online at westwoodmediacenter.tv. I'm happy to turn things over to your host, the Director for the Council on Aging, Lena Arena DeRosa. Lena, take it away.
Thank you, Connor. And I know I say this each time, but thank you, Westwood Media Center. Together, we are making sure our seniors stay connected and we make sure that our seniors know and are informed. So thank you, Westwood Media. And today I'd like to introduce Sue Flanagan. I have had the real pleasure of working with Sue for probably over 15 years, which is kind of scary, but it is what it is. Let me tell you a little bit about Sue and what she does for Blue Cross. Sue Flanagan is a senior plan consultant for Blue Cross Blue Shield of Massachusetts. She has worked for Blue Cross Blue Shield for the past 17 years and has over 20 years of experience working in the health insurance industry with a focus on Medicare products. Sue usually speaks to people in person, but today we're doing it all remotely. She has spoken each year on Medicare and related products. Sue enjoys educating attendees on the various health insurance options so they can leave the presentation with the confidence and knowledge to make informed decisions. Sue is married with 2 teenage children. And Sue, welcome. We're so glad. Thank you for taking the time to teach my seniors a little bit more of what they need to know about their health plan options. Take it over, Sue.
Thank you so much, Lena. Thank you. And I've loved working with you all these years, and I appreciate the opportunity to do this online right now. So thank you again. Welcome, everyone. Thank you for tuning in. As Lena said, my name is Sue Flanagan. I do work for Blue Cross. This is really not a Blue Cross product presentation. But what we're trying to do right now at this time of the year is October, November is the Medicare annual election period. So if you're on a Medicare plan at this time, this is the time you can relook at your plans and say, this plan is working great for me. I'm going to continue on. Or you might say, well, maybe I wish I had something of this or that. So it's a time that you can relook at your options and decide if you should stay or maybe change your plan. And so in today's presentation, we're going to talk quickly about Medicare. Then we're going to talk about an option called Medigap or Medicare supplement plans. We'll talk about prescription drug coverage, Medicare Advantage plans, and where you can go for more help after today. Now, we're going to really try to do a condensed version of this presentation, and Lena's going to come in and ask some common questions or some questions she might think that you have throughout the presentation. So this slide right here is really just showing you that once you're on Medicare, you could have Medicare alone and nothing else. But if you wanted more coverage than Medicare and you're buying your insurance on your own without the help of a former employer, there's 2 distinct pathways that you can go down to get that additional coverage. So you might be watching and you might be on the left side on going down a Medicare supplement or a prescription drug plan, and maybe your neighbor is on the right side going down choosing a Medicare Advantage plan. And both have weights and balances. So it's all depends on what you're looking for, what you need at that time. And again, this is the time that you can relook at these plans every year and decide if you should be staying on your plan or looking at other options. We're going to take each one of those boxes one at a time and really go through it. And then Lena will have some questions regarding it, any questions that you might have regarding those types of plans. The one note I do want to make on this page is that if you have an employer plan, so let's say you worked for the federal government, the state, a company for 20 or 30 years, your open enrollment time might be different. It's usually around this time, but you're going to always check with your employer or former employer about those options. But paying on your own, buying your own Medicare plan, October 15th through December 7th every year is your time to do whatever you want to change or keep those plans for a January 1st effective date. So I'm not going to spend a lot of time on Medicare because most of everyone tuning in health plan options for people with Medicare are on Medicare, but Medicare, again, is your starting point. You always need that. It's broken down into two parts. Part A, which is your hospitalization, skilled nursing, usually premium free. Part B, you're probably familiar. Part B does have a premium. In 2020, it was $144.60 coming automatically out of your Social Security check if you're collecting. Medicare usually releases its new figures sometime in October, November. So in January, that Part B premium may have increased from the 144.60, but we'll know that sometime in October, November. Now, Medicare, any doctor, any hospital, no referral. Medicare is always there for you when you're sick, problem diagnosis, but generally it's an 80-20 plan. Medicare covers 80% and you pay 20%. Here's a chart that's just showing some of the Medicare figures. We're not going to go through this here today, but overall, if you go into the hospital and you just had Medicare, you do have a hospital deductible for your first 60 days. Then you start to pay daily charges if you're there for more than 60 days. A skilled nursing facility is also under Medicare Part A. You do need to be admitted in the hospital 3 days prior, but then Medicare covers you the first 20 days at 100% and leaves you a daily charge at day 21. Now, Medicare Part B, that's all your doctor visits, whether you're in or out of the hospital, and all of your outpatient services, labs, x-rays, MRIs. Medicare has a $198 calendar year deductible, and then it's really just that 80-20. Now, Medicare doesn't cover outpatient prescription drugs. That's when we'll look at those Part D plans later on or included in a Medicare Advantage plan. And Medicare covers you anywhere in the US in our territories, but not worldwide. Doesn't add in routine vision, dental, and hearing. So that's a very, very quick rundown of Medicare. And when you go on or every year, sometime in October, November, you're going to get that big Medicare and You handbooklet, and it'll spell out everything you need to know about Medicare. So at this point, I'm just going to stop quickly and go over to Lena and see if she has any questions on Medicare.
Well, that was very, very well done. Thank you, Sue. The questions we normally get is, do people have to sign up for Medicare if they keep working? And if they keep working, what happens to a spouse?
Sure. So great question. So for the most time, when you're turning 65, a couple things, if you're already collecting Social Security, your Medicare card should come automatically to you. You don't have to sign up. But if you're turning 65 and you're not collecting Social Security, nothing happens automatically. So if you want your Medicare to start, you're going to sign up. But as Lena said, there's plenty of people that might say, well, I'm going to work past age 65. And I'm going to have my insurance through my employer. Do I need to sign up for Medicare? And that's a question you should really always go back to Social Security with. But as a general rule, if your company is more than 20 employees, they have more than 20 employees, and you're actively working with the health insurance through that employer, no, you don't need to sign up for Medicare. You're going to need to sign up when you're losing that coverage or no longer actively working. And the spouse, if your spouse is younger and you're still working past age 65, they can stay on your plan. If your spouse is older, they can stay on your plan. So company with 20 or more employees, you're treated the same as everybody else. Under 20 employees, then you need to talk to your employer about what options you have. Usually they're going to tell you do need Medicare A and B. So great question, Lena. Thank you.
Thanks. That really helped us understand it. All right. Now you're going to talk about supplement plans.
Yes. So one of the types of plans that you can take if you want more coverage than Medicare are called Medigap or Medicare supplement plans. Those two terms mean exactly the same thing, and they're a type of plan that's filling in the gaps or supplementing where Medicare left off. So on these plans, you're not going to see a lot of extras added in. You don't see money towards glasses, dental cleanings. You don't see the drug coverage. You still need to buy a separate plan. So when you have one of these plans, what you do have is the luxury of using Medicare the way it was set up to be used. Any doctor, any hospital, no referral. So Medicare is your primary plan. You always have those Medicare And then this health plan is picking up those Medicare leftover amounts. So in Massachusetts, we have 3 supplemental or Medigap plans that are regulated by the Division of Insurance, and they're all cover exactly the same thing. Now, some of these plans might add little extras that Medicare doesn't cover, but as a general rule, when you look at this chart, this is what the minimum coverage that you'll have no matter what company that you go on to. So these plans job always picking up the 20% that Medicare left behind. We have every company, like if you come to Blue Cross, you go to one of our competitors, they'll all have their own premium for these plans. But just to give you a general idea, and another note, once you are on Medicare, and if you are, you probably already know this, but everything's individualized. There's no more family or couple plans. So these type of options, supplement one plan would run you about 200 something dollars a month. And then when you look down at that plan, you see there's check marks going all the way down. That means everything that is a Medicare covered benefit is covered at 100% on that plan. So maybe you have a friend that says, oh, you pay co-payments on your plan. I don't pay co-payments. Well, that I go to any doctor and everything's covered. That would mean they're on a supplement one plan. Any doctor, any hospital, no co-payments, but they're paying about 200 something dollars a month. Another plan out there is a newer plan, Supplement 1A plan. And these plans were created because there was some legislation that said if you are turning 65 after January of 2020, that you couldn't enroll in one of these supplemental one plans any longer. So if you're already on it, you're on it. But let's say you're turning 65 next month, you couldn't take one of those plans. But you could take a very similar plan called Supplement 1A, which is exactly the same. Any doctor, any hospital, no co-payments after you pay an initial one-time deductible every year of $198. And that plan runs about $175 again, give or take which company you choose. And then a supplement core plan runs about 100. It's going to always pick up the biggest gap that Medicare left behind, which is at 20%. Still allows you to go to any doctor, any hospital, but you do have some deductibles if you go into the hospital, and you're going to pay that $198. And again, just a last note on this before I turn it over to Lena is that none of these plans include prescription drug coverage. So back to that model, you need Medicare, then one of these supplement plans. And people that are on these plans, if you have a friend that says, oh, I don't pay any co-payments or costs, well, that's great. But they also are buying a separate prescription drug plan. It's not included in these products. There's no family plan, so everything's dependent on once you're on Medicare, that's your starting point. Everything opens up for you. You can buy one of these plans, but it's always individualized. So kind of a good news too, because if you have different needs, your family can take different options.
Absolutely. And how often do the premiums change?
So the premiums typically change every year. So I work for Blue Cross. Our premiums change every January 1st on these supplemental plans, and most of the other carriers also, but there's a few that might change in July or so on the supplemental plans.
And of course, the big question is, what about pre-existing conditions?
Oh, great question, Lena. So if you're new to Medicare or you're thinking about switching over to your plans, know that there are no pre-existing conditions. There used to be end-stage renal disease if you were under age 65 on the supplement plans and end-stage renal on the Medicare Advantage, and that's going away for the Medicare Advantage. So, every October 15th through December 7th, you have that option to look at your plans and decide to switch. You don't have to worry about your medical conditions or health screenings or any of that in Massachusetts.
Which is super. All right,
Yep.
now I know you're going to be talking about Medicare Advantage plans. So I'll mute it again, and here goes.
Sure. Great. Thank you, Lena. So, before I go into the Medicare Advantage plans, I'm just going to finish out with the Medicare prescription drug plans. Because just to go back quickly, I want to show you this chart. We talked about Medicare, you need the Medicare, and then we went down this option of taking these supplemental plans saying, all right, I'd like to go to any doctor, any hospital, no referral, Supplement one plan covers everything and kind of go down the path if you want to pay less and have some cost share. But all of them, all of those options, you do need to buy a prescription drug plan. And prescription drug plan, when we say Medicare Part D, you might be inclined to say, okay, I'm going to call Social Security and say, give me Medicare Part D. But there's no such thing. Part D is through a private insurance company, and what you pay for Part D is what that private insurance company is charging. So a Part D plan can range anywhere like from $15 to $100 a month. No matter which one you choose, they're all going to follow a standard outline of coverage that's set by Medicare. And I'll show you that on the next page, the 3 levels. But within those plans, things such as the deductible, cost share, formulary, the list of drugs that they cover, the copays that you pay to take home your medications, those can change from plan to plan. But the outline of coverage doesn't change. So that's what I'm going to show you here. And if you're already on Medicare, you're probably familiar with this. We do have the 2001 figures now for Part D. The Medicare Part B figures haven't been released yet, but I have the updated for Part D. So in 2021, any Part D plan that you pick, whether it's a $15 plan or a $100 plan, they're going to allot you a set amount of money every year towards the total cost of your medications. And in 2021, that total cost is $4,130. So what that means is, let's say you pick a plan and you look up your medication and the medication says tier 1 or tier 2. Well, there's going to be a copayment associated with that tier. So let's just say it's a $10 copayment. You go to the pharmacy, you pick up your medication, maybe go to CVS, and CVS says, well, I'm charging $100 for this medication, but your copayment's only $10. So you pay $10 to take home that medication. But that allotment, they subtract the total cost from that allotment. So you paid 10, the plan paid 90, but they're going to subtract that full $100. Now you have $4,030 left to spend. So that scenario just continues on. And if you never use up all of that money, it just simply resets every January 1st. It doesn't carry over. So you might say, well, I'm only on a high blood pressure medication. And I would say most likely you're well under that $4,130. You're just paying co-payments to take home your medication. But if you said, well, I have very expensive medications, maybe $5,000, $6,000, well, you'll pay co-payments up to that $4,130, but eventually you're going to use it up. So you've debited down all that money. At that point in time, you'll enter what they call the coverage gap, and that's where you'll start to pay 25% of the cost of your medications. Most people are going to be in the initial coverage or the coverage gap. But if you said I had $10,000, $20,000 worth of medication, you would hit the last level of coverage called the catastrophic coverage. The catastrophic coverage is reached by you actually paying costs to take home your medication, not your premium. So your co-payments that you paid in the initial coverage, when you're paying cost in the coverage gap. If they ever said, okay, this person has now spent $6,550 out of their pocket, well, that person from the rest of that calendar year, the plan kicks back in and covers them at 95% and they pay 5%. So this is how all Part D plans will work, whether you pay $15 or $100 to buy that Part D plan. So back to you, Lena, for any questions.
All right, so one of the questions we get a lot of, I go to Florida in the winter. Will these plans follow me and how do they work?
Okay, so a Part D plan is usually you're choosing a regional plan in a region, but it will have a pharmacy network that's nationwide, so you wouldn't have to worry.
That's great. Okay, so I do have another question. Is there still a donut hole? And how do we deal with that? Can you talk about that?
Sure. So what is the donut hole? That is the coverage gap. It used to be called the donut hole because once you used up that allotment, let's say you used up that $4,130 years back, you would be in a donut hole. There would be no more coverage. You'd be paying 100% out of the cost of your own pocket to take home those medications. Now, over the years, they've lowered that percentage, and now they call it the coverage gap. And anybody that is in that coverage gap now pays 25% for their generics or brand name. So the coverage gap is the old donut hole. Great question.
Yep. And what about people who don't take any medication? Is there a penalty if they don't participate in this?
Sure. So another great question. So Part D is optional. You don't need to take a Part D plan. But if you don't take one and you don't have what the government calls creditable coverage, prescription drug coverage as good or better than a Part D plan, then if you later on want to take one, you're going to get a late enrollment penalty. So not to scare anybody, if you're still actively working, you have coverage to your employer, you probably have creditable coverage. You don't go out and buy a Part D plan. But let's say you're going down the pathway we just talked about of, I just have Medicare and a supplement. I don't need prescription drug coverage. I'll wait until I need it. That's how you would get that late enrollment penalty. Also, just want to note on this page, you see the Medicare Advantage plans on the side. Those are your HMOs and PPOs. They already include Part D. It's going to work the same way I just mentioned. It's just that you don't go out and buy it. It's embedded in that product. So great question.
Okay, so now I have some general questions. Are you done with your slides now? Are we good? Or do you have any more slides you want to present?
I have just a couple more, Lena. So now I would say that we talked about Medicare supplement and the prescription drug coverage, and now we're going to move on to a different pathway called Medicare Advantage pathways. And I always like to say at this point in the presentation, if you said, well, I'm kind of feeling unsettled that these supplement plans cost 100 or 200 and then I need to buy prescription drug coverage, I would say hold off because we're moving over to these Medicare Advantage plans. In these plans, their premium can be a zero premium plan. Most popular are under $100. So it's usually a lower premium, but you pay co-payments and cost as you go. Or somebody else, as I was presenting, might have been on a Medicare Advantage plan while I was presenting the supplement. And you said, I've been paying a lot of money for co-payments and I've been dealing with chemotherapy, radiation. I didn't know there was a plan that I could pay $175 or $200 a month, go wherever I want and have everything covered. So there's very good weights and balances between these plans, and sometimes there's a very clear path for people, and other times you're just lucky enough that both of these pathways may work for you. So just kind of closing here, the supplement plans usually higher premium, lots of freedom of choice, no co-pays, but you need to buy a separate drug plan. Moving over now, what we're talking about are Medicare Advantage plans, lower premium, medical and prescriptions all in one. You still need your Medicare, but you're paying just one lower premium. And they're going to work like your work plans, HMOs, PPOs, pay some co-payments as you go. This next
So,
slide right here is just showing you. Oh, sorry, Lena, go ahead.
no, go ahead.
This next slide right here is just showing you how those plans are funded. Because sometimes when I say, oh, a plan is a zero premium or lower cost, people worry and say, well, how would a company offer a plan for a zero premium? And it just works very different than the supplements. If you're joining a Medicare Advantage plan, Medicare is sending the plan a set amount of money every month for every member on that plan. You're also sending that company a premium, if there is one. They pool all that together. They contract with doctors and hospitals. They give you all of your Medicare covered benefits, plus additional benefits like money towards glasses, dental cleanings. The drug coverage is included. You don't go out and buy it on your own. In exchange for that, though, when you go to those doctors or hospitals, you're just showing you one healthcare card. Because if you showed Medicare, Medicare would say, hey, we already prepaid that plan to take care of you. So you're showing you one card. They bill the health plan. We pay the claims out of that pool of funds, and you're always paying a co-payment or cost along the way. So they work just like your work plans that you had, HMO, health maintenance organization, primary care doctor, getting referral, or PPO, which is a preferred provider organization. You can stay in network or out of network without a referral, medical prescriptions all in one, but you're not falling all those Medicare figures that we drilled down into. You always have Medicare benefits, but what you pay for them depends on the plan that you picked. So you might say, I'm going to pick a zero premium plan, and when I see my doctor, I pay $25, or I might pick a $50 plan and maybe I pay $10. So you would look at all of those different options for yourself.
This has been fantastic. Thank you, Sue. I have one last question.
Sure.
Where do people go if they need more help? Or if they're still confused?
Wonderful question. So next slide,
Because
I
let's
have these
face it,
helpful
you and I know
resources.
this, but not everybody gets this. So go for it.
Sure. Yeah, no. So there's a lot of information that we just went through in a short period of time. So hopefully it gave you some things to think about. But for more help after today, we have some great resources. There's the Medicare number, the Medicare website, Social Security. But the number I want to point out the most is SHINE, Serving Health Information Needs of Everyone. And you don't need to call that 800 number. Lena, how is SHINE working during COVID at your center?
Well, we actually did, and hopefully it'll be running at the same time that yours is. We actually had Lisa on, and we talked about that we have a SHINE counselor. We're probably getting a second one. We're doing it all remotely, but you can call, you can set up an appointment. Mitch, who is our SHINE counselor, who is phenomenal, he will call you back at the appropriate time when we have scheduled the appointment. So please, anyone out there who is confused or needs more information, more than what you can get at the website, and is thinking about retirement or is just about at retirement, call us at 781-329-8799 and sign up for a SHINE appointment. Mitch will then walk you through this and explain what you need to do. Is that about right, Sue?
That's perfect. I mean, SHINE is not related to any healthcare carrier. They know all the information that we just went through. And now you have a base to have that conversation and can really sit down and look at all your options with you and kind of sort this out. And if you qualify for any type of assistance programs, SHINE can also help you with that. We have a lot of great resources in Massachusetts that are income based sometimes, but not asset based. So many people qualify. So I always recommend, as Lena said, meeting with SHINE, and they do get busy at this time period. So
Absolutely.
make sure you call and make that appointment early.
And those appointments fill up fast. So if you're interested, make sure open enrollment starts, I believe, October 14th. Am I right?
October 15th. Yep.
October 15th. That was close. Remember, during open enrollment, you can find out more information. But meanwhile, please call us and sign up. We have limited amount of appointments, and Mitch can only do so much, but he is here almost every week starting in October, and he can call you. Unfortunately, you can't come in because of COVID, but you can talk to him on the phone and he can help you. Sue, thank you so much again for spending the morning today with us. Your information is always amazing. It's clear, it's concise, and we really appreciate you coming. So thank you again. And thank you, Westwood Media Center, for hosting us. We couldn't do this without you. And to my seniors out there, I always tell you, don't forget, wear your mask, wash your hands, social distance, and together we will get through this. This is not fun for any of us. We miss you all, but we hope that these small programs are really making a difference and helping you figure out where to move forward with. Thank you, Sue. Thank you, Westwood Media, and have a good day.
Thank you, Lena. Thank you, everyone.